Well, the country's vaccination program has been strongly criticized by many quarters. Despite the slow pace, vaccinations are still happening. To date, just under 3.5 million people have received at least one COVID-19 jab. University of Kwa-Zulu Natal's Professor Moshabela joins us now to reflect on the country's latest COVID-19 numbers and what we're likely to see in the coming days. Prof, thanks so much for your time. We appreciate it. So for the past 2 days, we have seen a slight decline in the infection rate. Is that a good sign? Does that mean we've reached the peak?
Yeah, good evening, Shane, and to the viewers. I think on the one side, we do have what looks like it's good news, especially when you zoom into the province of Gauteng. We've been seeing in the past, early on, about a week ago, that some districts in Gauteng are stabilizing, and now also the city of Johannesburg seems to have stabilized. Only Sidibeng district seems to be the one that continues to bring in new cases. But when we look more broadly at the curve in Gauteng, it seems to be at the peak, and it's showing signs of coming down. But I think, Shahan, it's important to specify that this is in terms of the cases that are diagnosed. And also this depends on the continued preventative measures and interventions that have been put in place just to help limit the spread. It's not so much, it doesn't tell us much about the issue of hospitalizations and deaths that are yet to hit the peak as well. And I think between now and maybe about a week to 2 weeks, then we may then be able to see those ones also come into a peak. And that will be an important turning point. I think that Gauteng drives the infections in South Africa, there's no doubt. And if Gauteng peaks, then we can hope that we can begin to see some sort of stabilization of the third wave across the country.
So how many days and how many consecutive days do we need to see a drop in numbers to decide whether or not we are passing that peak and the third wave?
Yeah, that's a very important question. I think what we are using currently is somewhere between 5 days. So we look at the upticks in terms of 5 consecutive days. If there is no decrease in that if there's no increase in cases in that 5 consecutive days, then that looks good. Then we can see that a district is stabilizing. But I think we also, as you know, use the 7-day average to actually see if there is sustained decrease. So I would say that towards the end of this week, Cheyenne, we will be able to see a clear trend as to whether this is coming down or is still remaining at the peak. But in itself, I think that turning point is something that we can actually use as a ray of hope. Given the situation in how devastating the situation in Gauteng has been. But it's a very good point. So let's give it a few days.
Yeah. So Friday, of course, you say would be a better indication. But the president, of course, that 14-day period of lockdown level 4 is supposed to end on Sunday or Monday. You know, is that enough time for him to make a decision on whether to adjust or not?
I certainly think so, Cheyenne. I think that in my own view, and here it's just making a lot of assumptions about a lot of moving pieces. But I think in my own view, as much as possible, if we have a clear indication by Friday, we should make a decision by Saturday, Sunday as to what happens with the issue of level 4. And my own opinion would be that if indeed Gauteng is stable and is showing a clear trend of stability, then we could, loosen some of the level 4 restrictions and go to a more adjusted level 3 restriction. That would be my opinion. And this is based on the fact that I think that we knew that the level 4 lockdown was meant to be a circuit breaker, and it may have achieved that if we stabilize Gauteng. And I do know that there are other provinces that are yet to peak. I acknowledge that, but I do think that we all can understand that Gauteng has been really driving the third wave.
Yeah. And Prof, let's move over to vaccinations. Just under 3 million people vaccinated. We're in July, well over half the year, and that's a really low number compared to the size of our population. What's your view on how this is unfolding?
Yeah, no, vaccination has been interesting, Cheyenne. I think it's also been interesting to me that this past weekend was full of news and memos that were coming from the Ministry of Health. And I think that just a few things to highlight. One is that pregnant women can now be vaccinated, and I think that's a big win. We need to talk about that. And lactating mothers, pregnant women above 14 weeks. And also the walk-ins, the issue of dealing with the walk-ins and the introduction of people who are 50 years and above. And I think that we are beginning to see some sort of movement, momentum, if I can call it that is sort of emerging from the vaccine rollout. And you can see now that the provinces like Gauteng and Western Cape are beginning to adopt more flexible approaches and to adapt to their own circumstances. It shows a sign of experience and confidence in what these provinces are doing. And we can expect to see the same from provinces like KZN and Limpopo that have also been in the running ahead. And Eastern Cape, actually, I was very surprised to see how well the Eastern Cape is doing with vaccination. So I would say, Cheyenne, that we are beginning to see a certain degree of maturity nationally in the vaccination rollout. You can even see the confidence with which some of the DDGs from the National Ministry are beginning to make decisions, especially in light of the vaccines becoming available. So there's something there, positive there to say. However, I think we cannot underestimate the importance of making sure that we move ahead rapidly in terms of the vaccination rollout. And Dr. Nicholas Crisp has indicated that they would soon want to open for people who are 40 and above, and that would be a positive development.
The question about us getting the vaccines, though, because we're still talking about 1.3, 1.4 million vaccines coming to the country. It's still very low, as it were. Yeah. So what more can government do to actually make sure that we speed up this process? Because we are reliant, right, on those manufacturers abroad.
Yeah, no, absolutely. It's a bit of a headache even for me, Cheyenne, because I've been wondering whether it would be wise to consider, for South Africa to consider the Oxford AstraZeneca vaccine as an option. And it's very difficult to make that decision because there's still, again, unanswered questions about the beta variant there. But given the Delta variant becoming dominant, and we're still monitoring how dominant it's going to be in other provinces, it's very difficult to make that decision. I do know that the news about the coronavac vaccine that's developed by Sinovac, it's positive, but it doesn't really change, in my view, the vaccination menu that we currently have in terms of the variants of concern. I think that we have to prepare in this third quarter of the year for a massive rollout in the fourth quarter. That's my view. I think that we have to allow the vaccination rollout to mature. As it's maturing, the doses are going to increase tremendously in the third quarter now, between July and September, but more so from September to December. So I think that we have to give ourselves 6 months from now to December to really achieve high levels of coverage for vaccines.
Yeah. All right. Thank you so much for your time and your insight. Appreciate it. Professor Mosa Moshabela, Acting Deputy Vice Chancellor at the University of KwaZulu-Natal.